Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Indapamide. Its brand name is Lozol. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Indapamide is a medication that's used for hypertension or high blood pressure. Its mechanism of action is not completely understood. However, it's presumed that it has renal as well as extrarenal effects. Specifically, its antihypertensive action is thought to be caused by a reduction in peripheral vascular resistance. In terms of its diuretic effects, it inhibits the reabsorption of water as well as electrolytes, primarily as a result of its action on the distal tubule. In terms of indications for use, I did mention that Indapamide is indicated to be used in the treatment of hypertension or high blood pressure, and it can also be used to treat edema associated with congestive heart failure. Now, before somebody was to use Indapamide or Lozol, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. It will be contraindicated in patients who have a hypersensitivity to Indapamide or to other sulfonamide-derived drugs. And it would also be contraindicated in patients who have anuria, which would be the inability of the kidneys to produce urine. In terms of precautions, this medication is not recommended to be used with the medication lithium. It should be noted that electrolyte imbalances such as hyponatremia, hypokalemia, as well as hypomagnesemia have all been reported with the use of this medication, and the risk of experiencing these electrolyte imbalances would increase if the patient was experiencing vomiting. Sometimes severe dose-related hyponatremia or low sodium has been reported, especially in elderly females. So in this population, we would want to start off and maintain the lowest possible effective dose. Hyperuricemia and gout have been associated with the use of Indapamide, so monitoring of this would be recommended. Manifestations of diabetes may occur with the use of this medication, and insulin requirements in diabetic patients may be altered. In patients with impaired liver function or progressive hepatic disease, hepatic coma may occur with fluid or electrolyte disturbances. Systemic lupus erythematosus may be exacerbated or aggravated. And lastly, progressive renal impairment may also occur with the use of this medication. There may be a consideration to withhold the dose or discontinue the medication altogether. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Indapamide, more often than not, they can expect to receive their dose in oral tablet form. When using this medication to treat hypertension, initially the dose would start off as 1.25 milligrams taken once daily in the morning. The dose may then be increased or titrated to 2.5 milligrams, again taken once daily in the morning, after 4 weeks of therapy. In terms of a maintenance dose, if 2.5 milligrams is not getting the patient to where they need to be, the dose may be increased after 4 weeks to 5 milligrams. However, some physicians may choose to add another antihypertensive agent rather than increasing the dose due to an increased risk of hypokalemia or low potassium. To treat edema associated with congestive heart failure, initially the dose would start off as 2.5 milligrams taken once daily, and then after 1 week of therapy, the dose may be increased to 5 milligrams once daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Indapamide or Lozol, so I'll go over some of those here now. Hypokalemia or low potassium comes in at a rate of 3 to 7%. Some patients may experience muscle cramps while using this medication. Dizziness comes in at 5% or greater, and headache comes in at about 5% as well. Some patients may experience lethargy or numbness, and some may experience fatigue or malaise. Some more serious side effects would be dermatological reactions such as Stevens-Johnson syndrome or toxic epidermal necrolysis. A granulocytosis and aplastic anemia may occur. And finally, hepatitis as well as anaphylaxis are also a risk of using Indapamide. That's all we're going to talk about today with Indapamide or Lozol. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.